Mariah, thank you so very much. Gene editing technology has led to massive innovations in medicine, evolution, and even agriculture. However, it has raised serious ethical questions about altering human DNA. Dr. Surani joins us live to talk about what CRISPR is, its benefits, and when this technology goes too far. Dr. Surani, it's so good to see you again. Thank you for visiting with us earlier this morning with Barbie. And now I get a chance to ask you a few questions. What is CRISPR and what does it mean for our advancements in medical technology?
Good morning, John Thomas. Glad to be here. The CRISPR is what we call is a gene editing tool. It's called clustered regularly interspaced short palindromic repeats. So in other words, that's something which you don't want to remember. What you want to remember is it's an editing tool. So in other words, it can go in your DNA and edit or delete some of the segments. And how it can be beneficial, for example, someone who has a genetic disease, you can go and edit those segments. There was a very recent study which was published where they used those editing tool in a patient who has a sickle cell disease or a thalassemia B. Sickle cell disease, we know that it's a hemoglobin issues, and they go into the editing tool and they edit the abnormal or hemoglobin gene. So the patient did not have any symptoms. Same case for the thalassemia. So that is a lot of medical value. Some of the patients may have a genetic disease. They may not get it. Now the question is that have it taken it further step forward, and what are the ethical dilemma? If you recall, we actually visited this issue in 2018 when Dr. KIII from China, he actually altered the embryo of the mother who was giving up birth to the baby, and he deleted the gene of HIV. So in other words, what happened is when the baby were born, they were supposed to have a HIV, and they were born without the HIV. That was a lot of hue and cry in the medical community because that technology was not very well tested 4 years ago, and again, it creates a lot of ethical dilemma. To use it in a medical therapy or even understanding evolution, that why we lost the tail from our, the apes to human race makes sense. But the question comes in that could it take into a far that I want to have a blue eyes, blonde hair, I want my kid to be tall, I want my kids to be very smart, and you start editing the embryo, and you always run a risk that while trying to edit, can you mess up something up? So I think the ethical ground is going to be very, very important. And we were thinking that, well, the CRISPR is coming in. Well, it is not coming in, it's already here. So I think everything comes to this benefit as long as it is used in a right context. But when you try to take it a step forward, that's where you end up into ethical dilemma.
Okay, Dr. Surani, some say playing God, but we'll see how that works, especially if it saves lives. Dr. Surani, as always, a pleasure. Thank you so very much. If you have a question or even a topic you'd like us to cover, send us a text at 361-855-6397.